Are we on? Can you hear me? Can you hear me? Microphone check. Lights. Cameras.
This is swanky. This is lifestyle. This is culture. Welcome to the social center of everything culture. Culture Daily.
We couldn't do it any better for us this morning with that song. I hope it's Pool before I say something else, because I saw P-U-L. So please, pardon me, but that's Last Mate in there as well. I think Last Mate is also in Zimbabwe, or is it Zambia or Zimbabwe? Doing some show there with Balo Ranking. I think I saw that on Red News as well. So shouts going out to all our artists going global. Good work. Keep pushing the GH, on the map. Thank you very much. And we as well, localized in here, will also do our jobs. But anyway, it is time for a big conversation. It's Tuesday morning, and that means we're talking health. Before that, though, very important, brush your teeth morning and evening with Pepsodent Charcoal and the Herbal Toothpaste. Now, I tell you what, the charcoal has a fine blend of fluoride, natural charcoal, lemon, mint, and zinc to whiten your teeth, strengthen them, and remove bad odor from your mouth as well. And the Herbal is made from green tea and herbal extracts. Now, this is formulated to repair and protect your gums whilst giving you an all-round cooling sensation. So make sure you brush your teeth morning and evening with any of these two variants of Pepsodent. Whilst you are at that, enjoy some entertainment on television, on DSTV and on GoTV exclusively. On 198 on DSTV and 149 on GoTV. You can't miss it. It's Big Brother Naija Season 9. They say blink your eye and you'd miss a lot. Fortunes can just shift to the opposite. Lenny, what's the opposite of fortunes?
Misfortunes.
No. What's the opposite of did? Don't say didn't.
Oh.
Mortal.
Mortal in the mat.
What's the opposite of can?
Can't.
See?
Is that not it?
It's not cantamanto. But so you see, if you blink your eye on the show and you miss a lot.
Jay, it's only your eye you can blink, you know that.
Oh, it's a blink on an eye, but we say blink of an eye, right? We don't say just blink and say blink of an eye. Like,
I'm just saying.
No, but it's blink of an eye. Like Lenny, it's here, blink of an eye. Okay, how about?
No, it's correct. I'm just saying.
Also, it's correct.
Wrong,
I told you if you blink an eye on this show, you miss a lot. But in the drama, it's about to happen. Thank you very much, Lenny. Yesterday, she was my Uber driver. Yes, I requested for her and she picked me up. Thank you very much.
And he still owes me my 2,000 cedis.
Oh, Lenny.
KPMG to Team Music TV, yes. Expensive Uber driver.
I would you 2,000.
Patwine.
I Uber luxury now.
Patwine.
So, Big Brother Naija Season 9 is happening. If you blink, Lenny says only the eye you blink, so I won't add the eye to it.
Oh, you can add it. I'm not saying it's wrong.
Okay. Thank you very much. I'll add it to it. If you blink an eye, or the two eyes, blink, you miss out a lot. So please stay tuned and keep watching Big Brother Naija. There's 100 million naira prize up for grabs for the contestants or participants or the housemates. Let's move on now. Live Resto Lounge also got great news this afternoon. Be a kind guy and take your woman out. Don't be chisel, please. Take her to Live Resto Lounge. Now, Live Resto Lounge is in East Legon, Bauleshi Road. You don't want to miss this. Listen, there's everything there. Mutuo, Tozafi, Fufu, light soup, everything you want in there. Just call 020-133-7766 to experience Live Resto Lounge. Hurry. Hey, Lancaster Uni's got great news for you, all you school lovers. So if you want a British degree at a fraction of the cost, that's about 50% on scholarship. It's happening at Lancaster. So apply now. Go on to the website. It's lancaster.edu.gh, or you can also email admissions@lancaster.edu.gh or call 0209 607008. Lancaster University, the only British university campus in West Africa. Okay. There's also more to tell you. Extravaganza happened over the weekend. We showed you highlights on that. You can catch more on We Outside this weekend here on 3 Music TV. Now, this morning, we're talking about airborne diseases. Quite a number of them out there. Up for grabs, if you get it, up for grabs. So very soon, already our waters are being poisoned. So we are being careful what we drink. But we also can't forget what we are breathing in. If you're in a crowded place, whether you're in an area where you feel, in an enclosed area, even imagine you go to the bank, and there's a guy in the corner somewhere who's just and even covering his handkerchief. And you think that you're safe. Well, it's very important for us to understand some of these very common airborne diseases, especially when in the season where we're talking about a lot of, effects on human life or mankind or humankind. This morning, of course, Dr. Chris is here, and also Grace is here. Grace, an influencer, and then he said human rights advocate. Public health advocate. Public health. I was going to say, I'm also advocating for us to end this Galamsey menace. But I hope when you open your taps, the water is clean and
absolutely.
Okay. Then your area is very good because some areas are really suffering. I know we may not necessarily attribute it to Galamsey, but at the end of the day, I didn't pay for brown water. Yes, I paid for clear, clean water. Can we drink the water that comes from our taps? Hey, doctors, advocates.
Advocates left the chat.
It's not advisable, I know, because a lot of things happening, So gone are the days when we fetch it into a bottle, and then we
put it in the fridge.
Yes. Doc, in the interest of time, I'll skip our cosmetology conversation and just fast track a little because of time is fast spent.
All right.
But we want to talk about airborne diseases. Like I said, we know we're already suffering from what we are consuming, but now to what we are breathing, it's becoming a problem as well. So I know when I was in primary school, in a very good school, I was told about airborne diseases, and once it's airborne, so it means that once I'm breathing in, it's going through my nostrils and then into my body. Are there any particular ones? Let's take them one by one. The very common ones that are prevalent in our side of town. You can even narrow it down to Accra or maybe this area, I believe. Because I know in certain areas when you go there, are other ones you get. Lenny's area, for example.
Lenny, what's prevalent in your area?
Hey, nothing. Hey, how dare me bring Lenny's area something that's happening there? Nothing.
I was just waiting for you to see.
Please, I want
Vim.
So yes, where do we start from?
We're going to start from the common one, common cold.
Okay,
we're going to start from common cold and its prevalence.
But sorry, before that, Grace, let me just before I come to you, Chris, I'm sorry. Since you're a public health advocate, what are the things you preach about day in, day out to us Ghanaians?
Okay.
Just to narrow down your space and what you do.
Okay. Regarding code?
So I need to yeah. So public health advocacy. What do we understand by this? It's a very broad topic.
Yes, because health workers do it actually.
Okay, so we are all part of it. Oh, okay.
Anybody who is always making noise about health, do this, do that. Everybody's an advocate.
Okay, all right. Then
Lenny
advocate.
The senior advocate.
He doesn't know.
I was trying to see there were specific areas that you are really focused on under public health advocates with where you are engaged. That's just what I was trying to narrow it down. But
please.
okay, it's broad.
General,
Hey, and your work is big.
So most people go to school and study public health, like in general, about diseases and how they prevalence, how they are caused, and all that. So with what she would do is that they usually take what's happening in the society at a certain point in time.
Okay.
Because we know common cold from June to about September is a window for flu.
Flu
season.
Oh, okay.
So if you look
this.
back if you look at the point of June where the rains come in and all that, people come with cold, cough. So we know that in Ghana here, within that period, you should also expect malaria in there. You should also expect the flu in there. So when somebody presents to hospital with those symptoms, at the back of your mind, you are thinking, okay, it could be this. So you try to rule out what it's not, then rule out what is available, then you treat for that. Okay, Doc, so run us through, which ones should we pick? The very common ones let's do common cold, because most people have it, and then I'll talk about the differences, because sometimes we confuse the common cold with flu. There's this confusion about common cold and flu,
like rat and mouse.
Yes, same family but different. So people, if you ask somebody, what do you have? You say I have a flu, when it could just be common cold, right? So so let's run through. Let's go through that. Flu and
and a common cold. Interesting. Why is it one more senior than the other or something?
Yes, one is more senior than the other. One is more severe than the other.
Okay.
So flu is more severe than common cold.
Okay.
Common-
Flu is more severe than common cold. Okay. What
I have
makes
a
it?
PPT for that? Yeah.
Okay, can we put that on the screen now? What makes the difference between a common cold and a flu, and which one in our space per your engagements is very common? I know you say common cold, but I'm sure maybe no. The description of common there, I believe, is not because it is. What is it? Because it is
Because it's common.
It's common.
Because you easily pick it up.
So we don't see
from
common
surfaces. So somebody sneezes or coughs, it touches a surface. You touch it, you can get it.
Yeesh.
Now, most people get this the serious level if your immune system is compromised.
Mm-hmm.
So if you have an underlying condition such as maybe you have HIV, your immune system is already shut. So it's easy for other pathogens and other bacteria to get in. And common cold is there. So we always used to attribute the fact that if common cold can shut you down, it means you are really compromised. Because your body should be able to fight, build up a defense against common cold. It's like the basics. You should see common cold, be like, oh yeah, we've seen you, we know you, like with a bit of rest and hydration. Yeah, so I listed just 4 for us to discuss today. And the boss of it is the one we all dealt with a few years ago. Then we go to the common cold, then we go to the influenza virus, then we go to TB. TB is a bacteria. It's caused by bacteria, not virus. There are 3 viruses.
Okay, we are going to understand all these scientific terms today. Yes. So let's start with the common cold and the flu, and what is the difference?
No, so common cold, we use symptoms. We're going to use symptoms. So I have a chart that tells you. So we use a chart. So before I go on, I want to talk about this chart over there.
Okay.
Now every flu. Go back. Can we go back? Every flu, every airborne disease affects 2 parts of the respiratory system. It's either the upper part or the lower part.
Okay.
So then we have upper respiratory tract infection, then you have lower respiratory tract infection. Now with upper part, it consists of your nasal cavity from your nasal cavity as your nose, the beginning of your nose, then ends at your pharynx, which is your throat. Now as we go down to your voice box, larynx, that side, we go into your lower respiratory tract. To your bronchi, to your bronchos, that's your lungs.
Your Lenny, or those pieces,
Hey, Charlie.
So if you have a pneumonia, we can say a pneumonia is lower tract infection because it's in your lungs.
Okay.
Right. Then when you talk about something like a common cold, is upper respiratory tract infection. Now COVID could attack both parts.
It could.
Yes.
Or it does.
It did do that.
Okay.
So it started with people having sneezing, coughing, right? Then got to a point where it was so severe that people started drowning in their own fluid because the lungs started filling with fluid in trying to fight the infection. And they drowned in it and some died.
Yeah.
Right. So we're going to start from the upper respiratory tract, which is more common. Then we'll go down to what happens when it gets severe.
Okay. So, okay.
And our next...
so let's go on to the next slide now. Okay.
Now, so we look at common cold, right? It's a viral infection. It affects the upper respiratory tract, which is very important, upper. So, and it's characterized by these symptoms. So you have a runny nose, you have a stuffy nose, sneezing, you are coughing, you have a sore throat, you feel tired, which is fatigue, you have a headache, and you have a mild fever. The word is mild fever.
Science students, what is the mucus? what? I didn't go there. What is that mucus in our? What is it? What is it? What is it? Is it dust with water that turns that? I want to understand what that mucus is.
All right. So
does the body produce it by itself or something?
It's actually a defense mechanism your body has.
Okay.
You know, one of the most difficult places for infection to get into your body is through your nose, your mouth, right, and your ears. Now, your nose and your mouth are connected at the back. They meet. That's why sometimes when I give you a nasal drop, you tend to taste it in your mouth.
Or maybe sometimes ear drop.
Yeah, ear drop. Yeah, you taste it. You start tasting your mouth. Now, the design of such a place is that it has certain defense mechanisms, which starts from, let's say, the hair in your nose. It filters out dust, so it makes it difficult for bigger particles to pass through because the hair in your nose does that. It filters. That's your first defense. Now, when it moves further down, you have the lining of the cavity, the passageway, which contains cedar-like, hair-like projections there that also trap this dust. And there's also there's moisture there, because in trapping dust, you need moisture to hold down. That's why when you're sweeping with dust, you like to sprinkle water over the place to try and get it all together. So when your nasal cavity and oral cavity have gathered all this debris and all these things that could harm you, that could go down, because if it allows it to go down, it's going to enter your lungs.
Yeah.
Whereas there, then you have to start coughing. I'm having a testy cough because you're coughing from your lung, trying to get rid of the irritants that are there. So this trap and the mucus plus the fluid, the moisture plus the dust, the hair. So if you look at mucus, when you spit it out, you see hair in there.
Sometimes.
Sometimes you see hair in there. You see sometimes it's brown, dust, and other particles. If you look closely, you don't have a microscope, but if you look closer, you see all these things. So we use the color to determine whether you have an infection. If your mucus is white and clear, you're okay. If it's getting yellowish side, greenish, then we tell you have an infection.
Okay, so the body is producing this mucus
As a defense
mechanism.
Yes.
Oh.
The same way we produce saliva to help in digestion.
So for us clearing our noses is because we can't have smooth breathing is the reason why we clear. But if not so, we would have just left it there like that.
Yes, it means everything will just go through like a passage. You just walk through. Anybody else, anything you breathe in, will just walk through. Whether it's dust, whether it's pollen, you just be going down there.
So the more severe the infection, the more mucus is being produced. Hence the reason why maybe sometimes you are blocked completely and okay, so the inhalers that we use and stuff like that.
It's decongestant.
Yes, it decongest, but then that means that it's clearing the pathway again, or
because when I'll use an example for you where when the weather is cold,
yes,
right. Or let me use a room. When you enter a room, right, and the room is brightly lit like this place, your eyes sort of don't open wider because there's too much light. It sort of dilates. No, it constricts rather. Constricts rather. Now, when the room gets dark,
open it.
Yes, open it. So when you dilate, it means the room is really dark, so absorb light. Now, in the same way, when your body is trying to fight all these things, it's trying to prevent more things from going down there, so it starts to constrict your airway. Because the irritation starts to constrict the pathway to reduce the amount of irritants that are going through. Then you get a congestion. Now, in trying to decongest, you need something to tell the surface of those areas to relax, to let air through. That's why even if you do it and are still being exposed to that pathogen, it will start. You get congestion again.
Okay, Grace, let me ask you this. I don't know whether you'd have an answer to, but I'm sure you would, because now that people are broadening this thing for me. When we try to cure, can we cure flus? I mean, so common colds, because we sometimes take medication, but I hear that you can't cure viruses.
Yes, you can't.
Yeah, I think we can manage it. I'm going to be speaking as a mother.
Yes.
Yeah, children are really susceptible to cold.
Okay, I think I need you to come closer to the mic. Yeah, yes.
Okay. So I'm going to be speaking as a mother.
Okay.
Yeah, children get cold easily.
Yes.
And then you tend to ask yourself, can I really cure this cold? Because they struggle a lot when they're breathing. No. So I think curing cold, no, but you can manage it.
You can manage it.
Yes. I have a 10-month-old baby, and then every now and then when we're exposed to, people out there, maybe in church, go for events and all, the next minute he has cold. So I think the only way I've been able to manage it, not to say cure, because the next minute they have cold, whether you like it or not, is to use the saline drop. I think Doc knows about it.
Saline drop.
Yes, children can use the balm. Yes, the medication. So the doctors prescribe saline drops, and then a lot of steaming for children, basically. So I don't think it's curable, but you can manage it, right?
Yes, you can manage it.
Should that also, or will that also be the case for adults as well? Because there are some people who constantly have a cold, void of it being allergies or whatever. There's always something.
Yeah, my husband is one person like that. So whenever he touches anything cold, he starts sneezing. Yeah, I think so. I don't think there's a cure, basically, but I think it's manageable
For adults
as well.
Okay.
Yeah.
So Doc, then back to our conversation. So now, at what point in time does it become a flu, and at what point in time?
So I'm going to show you a chart.
Okay.
So we're going,
all right.
This is
so
what we use in diagnosis.
Okay.
So we're going to basically, when you want to do common cold and airborne disease, we do a lot of history. Your history, the symptoms. Then we try to rule out, could it be this, could it be that. So there's a chart. If you could show you see, we could all go through it and even use it as our own marker and see where we fall, whether ours is a flu or is a. So before she goes on, so we talk about symptoms like, let's say a patient comes with a runny nose.
Yeah.
That's one. That's check. And there's respiratory tract infection somewhere. There's something going on. Now the first question I'm going to ask you that when did it start? Then they give you a duration.
Yeah.
Or did you go somewhere?
And I'm told viruses have a 14-day incubation period.
Yes, and some of them can even hide. As I said, your immune system could also be a problem. Now, you see that? That's my beautiful chart right there. That's our culture daily chart.
Okay.
For determining whether. So if you have a common cold, you're a blue. If you have a flu caused by influenza or other viruses, influenza viruses, you're a green.
Yeah.
If you are if you are pink, it means you are 4 years ago. You are in that bracket.
Yeah.
So the first one is fever or chills, right? With common cold, right? You see our checkbox is gone. So the person doesn't have a cold, right? Then we go with the headache. So with the headache, with the fever and chills, only flu and COVID-19 check those boxes.
Oof. Okay.
For flu, right? Now the severity will determine which one it is.
Whether it's a flu or...
Whether it's because you can also say, so I was about to say something. COVID-19, right, has cold. You get cold when you have COVID-19.
You get a flu.
Yeah, you get a flu too, right? Now, you go to headache. Are you having a headache? The person says, no, I'm not having a headache. So then we're like, okay, it's not cold. Person comes, that person says, I have a headache. So we are thinking, is it flu or COVID-19? Okay, we are still in that bracket still. Patient comes, muscle pain or body aches? No. Feeling tired? When you do something, do you feel weak or like when you get out of bed? So no. Okay. Yes, okay, what's this one? Sore throat. Oh yeah, it checks a box.
That one's another one that we need to discuss. That thing has been.
People wake up with it.
What's cry? It's also another infection, eh?
Yeah, it is.
Caused by who and what and where and why?
It could be so many things. It could be so many pathogens. The dust. It could be you're allergic to something.
What I want to understand. I know various parts of the body, certain things. Is there something that's in our throats that is so weak that certain bacteria types affect? We breathe in or we swallow or we drink or we take, and then boom, sore throat. Because sometimes you wonder.
Yeah. So sore throat's definition is because of where it is, the position. If you look anatomically, it moves and it settles. And if you look at it, there's a projection.
Okay.
In there. So when you are in stasis, like you are asleep, most things will move down. They'll just stay there.
Yeah.
Saliva goes to stay there. Everything goes to settle there. So you help people waking up.
See me swallowing right now.
Yeah. A lot of people watching right now. Probably taking a sip of water. Looking for something to drink right now.
For some people, Doc, wouldn't it be food? Because I know someone that is allergic to certain foods that when she eats, immediately she gets sore throat.
Yeah, so our definition of sore throat could depend on which part of your throat it is.
Okay.
Because some people, if you look in somebody's mouth and look down there, you see a ball hanging like a punching bag.
Yeah.
Because the epiglottis.
Oh, that's epiglottis.
The tonsils are the left and right. If you go beyond it, they are on the left and right. So the tonsils also contain lymph nodes and other things that help protect you against diseases and infections. Now, if they get inflamed, that's why we look in your mouth. Stick your tongue out, we punch a light through there. But when we look at those sites and it's inflamed, it's getting reddish, you can have whitish lining. It depends on what we are seeing.
Okay.
You can have like scars in your mouth. You're having sores in your mouth. It means that we are thinking scurvy. Your vitamin C level is probably low. You need to work on that. Your teeth is falling out. It could be a cancer. Naturally, your teeth just keeps pulling out. Maybe you're undergoing cancer treatment. That could be the reason, or could be that your levels of iron or potassium is low, right? Then we are looking so many things. Just looking at somebody's mouth alone, or that's why we look at their eyelid. You're looking for jaundice. You're looking for a pallor. You're looking for a person anemic. Pregnancy is a lie.
Are common colds fatal?
No,
they're not.
No. If you show the chart, that's what I'm about to go. There's a last part.
Okay,
let's
go back to the charts. Something that was very common during the heavy COVID era. But let's go through.
Now we're getting to the interesting part. Now look at sneezing.
Sneezing, only cold.
Only cold has that. Right. Then look at cough.
All three. Okay.
So that's
sneezing is from nose. Cough is from mouth. Throat. Sorry.
Yes.
Okay.
Lower. It's more lower. Right. That's why during the COVID period they kept saying that when you cough into your arm, but they never say when you sneeze into your arm. It was always about cough. Because there's accumulation over there, the contents that you're about to. Because sneezing is just here. It's closer.
Doc, prior to COVID-19, should you have all these symptoms? Where would you put it? Because if you have
kolu.
there are people who were getting all of these symptoms, but then it wasn't said that was COVID-19.
But they were not getting this, the last part.
The last part,
change
and
in
then,
a loss of taste or smell. Yes, I experienced. Did you experience COVID in any
No,
way?
I didn't.
That's why they will tell you is you
Two
don't.
times.
We take a lot of things for granted.
I heard.
So
that
I
take a lot of
they
things.
use that.
Imagine losing you're looking at the food. You're hungry.
I had to eat extremely hot pepper to just taste a little of the pepper.
of the pepper.
Yes.
But that happens when people get flu sometimes, doesn't it?
No,
No.
no, you don't get that.
Like you don't lose your
No, you don't
taste
lose. You don't lose your smell. You don't lose taste.
smell
I'm telling you, zero. We are talking about zero. You don't taste what. If I put sugar right now, you can't tell me sugar.
at
Yeah,
all.
yeah.
Zero- you-
Okay.
That's
If
how
it's
bad it
at
was.
all,
The
then
first one I lost,
get it.
I lost smell. Second one I lost taste.
Wow.
Yeah.
Thank
So
God
you
for
went
your
through the whole
life.
cycle.
Yeah, the whole cycle. I went 2 times.
Were you feverish?
In the beginning, yes. I was trying to act as if I was
Hard guy.
Hard guy. I think I even felt it the
Wow.
more when they called me to tell me that I had
Your
contracted
results,
the
yeah.
virus, and then I was driving to Osu that day, and then they called me because I was going to do the test because somebody within the
Community.
the premises where I was working,
Okay.
had gotten COVID, and also they didn't say I was coming to work like that.
It was asymptomatic.
Yeah, so they no, he knew, and he
knew?
didn't say it.
Oh, but that's bad.
Very, very
That's
bad.
criminal.
Yeah. So they came to check all of us.
It was
And
in Charlie Howe,
it
Charlie
was
Howe.
the following morning when I
And
woke
a foul.
up, I could feel some body pain, some wave in my joints were
They
all
checked
some
everybody
way. I
and
was
they
feeling
picked him.
slightly feverish. But I said, oh, this one day, never. How? Never. No. Then I set off to work, and then they called me that, please, this is Mr. Foley. I said, yes. Please, we have your results are in. And, yeah, you are positive. Yeah.
Hey.
So where are you? I said, you know what? I live alone. Don't worry. The one who can't guide me to some place by then. I said, don't worry. I'm driving alone. I gave myself up. I said, I'm driving. I'm alone in my car. There's somebody here. I'm just gonna turn around and go back home quietly. So I just on the tertiary road, I just turn around nicely and then holiday. Yeah, I just went. But the stigma.
You
and all
know,
that
people
thing.
go away with work with that thing.
I know I have COVID.
Man, people will just come to work and fake it.
I think tomorrow.
Yeah, people come to work. They want to go to work.
Tomorrow, nothing. Dog,
I'm just in a
let's
good time.
continue.
Look,
I
yeah,
hope
I
so.
want to find out why there's always this twin effect with these airborne diseases. Like, is it necessary for them?
Ask again.
Yeah, like
It has to come with
it
something.
has to come to like it's like like it's like a marriage. Like
Yeah.
you have a
Sore
cold.
throats, no, then it goes into
There's
flu, then
something.
then
like,
you're
what's up?
coughing,
No,
sneezing,
because
then
ENT, eyes, nose, throat, ears, nose, throat. Sorry,
Uh-huh.
these 3,
Uh-huh.
they are connected, whether we like it or
You
not.
said what? Eyes,
Ears,
Yeah.
ears,
nose,
nose, and
throat.
throat.
So,
Okay.
so there's a whole department for these 3.
Yeah, there's
ENT department.
So
Yeah.
one department gets affected and everybody.
Everybody's coming along. It's so bad that sometimes it can even go as far as your eyes.
Yeah, I
Like you're tearing up, you have like irritations in your eyes, and all
Reddish
that, reddish
eyes.
eyes, and all that. This whole your head
Mm-hmm.
is so sensitive. Whatever you breathe in, whatever you eat, whatever.
is there any advice you give to people, about the awareness of this? Because now we are taking it for granted. We've taken it for granted for a very long time.
I asked you a
know.
question
Yeah.
today. I asked somebody that you have a cold. The person had a cold, and the person was coughing. Kept coughing. I was like, how long have you had this cough? He said, oh, I've had it since Saturday, but it's better than yesterday. I was like, have you taken anything for it? He said, oh, no. I
No.
said, you might want to get a bottle of water. It starts like,
The person who hasn't gone to the hospital.
yeah. So
or
I was like,
pharmacy.
you might want to get a bottle of water to sip on. He said, oh, there's no water around here. I said, we don't have, so you might want to like go and grab one. Person goes and returns. And I see that the bottle is sweating. I'm like-
Cold water.
It's like, is that cold water? I say,
why
yes.
shouldn't
And
you
the person is
drink cold water?
smiling.
Yeah,
Why
that's-
shouldn't you drink cold water?
Yeah, why? It's because I'm coffee. I can't drink cold water.
Virus loves it.
Is it?
Loves cold.
They thrive in
It
cold.
thrive in cold. They multiply in cold.
Right.
You introduce heat.
So what is it doing in Africa?
That be why we dey drink the precursor hot like that.
No. So what is it doing in Africa? No. The question.
That's
I'm
why
asking-
she mentioned inhalation, right?
Yeah.
Yeah.
You put your
So sometimes they trap in the hair in your nose. So
Yeah.
if you put water in there, it's sort of flashing. You're sort of like reducing the amount of them there. Because
So you can even just do it on a regular
on a
basis.
regular
You don't
basis,
need
yeah,
to
you
have
don't need to have a
to
cold.
be able to.
No, but the
oh.
question
especially when
I'm
you've been in
asking-
crowded places. If you feel like you've gone to a place where it's crowded, you feel like you've mingled with a lot of
detox.
people, you should probably get on it quick before it gets on you quick.
So no, the question
Right.
I'm asking
Okay.
again is, so why is it common in Africa? But I know not entire Africa is warm, but at least if you want to find warm, you can come here. We'll show you small.
In the words of Dr. Sumeni of Kolebu, respiratory health. Poverty.
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 No, but there's kind of sunshine because if you go to Upper North, for example,
They have it too.
Yeah, that's what I'm saying. That I mean, if it thrives very well in cold places,
Why do you think it's hiding where it is?
where inside like our nasal
Moist,
cavity.
yeah, it's so moist, cool, so nice in there because
Hey, Doc, describe well or not. No,
Doc,
So-
please, however you want to say.
so
It's only Jay's mind.
you will discuss it off.
our even the prevalence of respiratory disease like TB, the first risk factor is poverty, malnutrition, because poverty will let you not eat well. Poverty will let you sleep in a place that is less ventilated, like it's not ventilated well. Poverty, because I don't want to. I'm not partisan. Somebody will say I always want to see this first before I say this. I'm not partisan, but with the advent of senior high schools being very crowded now, right? If somebody with TB, one student gets TB in that room, we always say the rate is 10, 1:10. So one person gets more, at least 10 people get.
Okay, I want to quickly come to TB, but just because of time. So now the flu and the cold. No, I want to just leap from when does it become a flu and when does it become a cold?
So your cold becomes a flu when it starts making you weak.
Okay.
It starts making you have sore throat. You're having dizziness. It starts becoming a systemic. It becomes a systemic condition now. It became symptoms, just symptoms that you're not feeling okay. I don't feel just well, but all of a sudden now it's preventing you from doing basic activities that you can do normally.
Okay.
Because you could have gotten out of bed to make yourself a meal. Now you can
But
get
now
out
you
of bed.
can't,
Now you
yeah.
have joint pain. You have general body weakness. All this is leading up to. So systemically, it started from something symptomatic to you be able to go about and wear a nose mask to now not being able to do the basic things like making yourself a cup of tea. So I always advocate that at this period when you start seeing something like sore throat, that you should get a cup of tea. No, me can't tea. I don't want the milk. I could go. No, the honey. No, like I mean, tea in this raw state of form,
Tea bag.
like a tea bag.
But it doesn't also necessarily have to be a tea bag.
It doesn't have to be a tea bag. It has to be something warm. You can do your ginger tea.
You can do
So
precocet
tea. So tea because
Yeah.
of heat and what do you call it? What's the word for this? Detox.
Okay.
Some of this ginger does a lot of detox. Honey does it very well too. Honey is very good for asthma even because it helps to open up your
You can
airway.
even do your lemons.
Your lemon. So I do lemon when I'm having that.
Hey, Charlie, me when I get cold, yeah, they drink my
Pepper. I think we are even
cold
forgetting
pepper is
juice
there.
cry and
Yeah.
I give.
Yeah. So
When I get cold and I drink my cold juice cry, then I get kappa.
Coming to that,
Hey.
right? Coming to that, Doc, you mentioned someone got a bottle of water that was sweating because it
Yes.
was cold,
Yeah.
right? Grace, you mentioned that your husband is also very,
Yeah.
cold addictive.
Yeah.
Let me say this. We're having a conversation sometime, a friend of mine and I, right, who has allergies, sneezes a lot. And he says that when he puts his head in the fridge, he finds relief.
yes.
Right? Sinusitis.
Sinusitis. So
Yes.
he's
When you drink water, you feel relief. Like it stops.
yes.
I'm only saying this because
Wow.
Jay is also saying the same thing.
Yeah,
And
so-
why is
I
that?
don't have sinusitis. So.
Yeah. No, I guess I'm just saying the correlation that
So the stopping we are talking about is we are talking about a relief that is short-lived.
okay.
So it's short-lived for that period. It's like you having a very severe headache and then you thinking that people put ice pack on their head, or the way you have cramps and you put heat pack to try and it's relief, but
Okay,
it's not prolonged because as soon as he gets it out of that fridge, and he comes back to after a few minutes, it's going to come back.
Right.
If you drink that cold, that way he's saying, have you seen this before? The person takes cold drink, right? He has a flu and says he's not going to work, so he's home, takes a cold drink, then he's gingered up, then starts doing house chores. Then he does all the house chores. Then that night, it's bad. It's like it's worse.
Okay. Yeah. I'm sorry, but the time is running, so I want to jump to another thing because since we're in the cold world, we're in Europe. Let's. I want to ask. I know it's going on to the next one, but pneumonia. So the myth is that say when I sleep under the fan or I sleep in the AC for a long time or long hours, I'll get pneumonia. I hear that thing. I've been hearing it since childhood. I don't know how true that is. But what are the risks involved with sleeping under air condition or fan, continuously? Does any of the things we listed here fall in that category of things that can let you
Yes. So
contract such?
yeah. So with the AC, your normal body temperature for optimum
Function,
function it's it's a range, 37.2 to about 38.2, if I'm not wrong. But it's that range. Now, if you push your body below that point, certain pathogens that don't survive in certain conditions at your normal body will start to survive. They're going to start multiplying. Because the reason why viruses and bacteria don't do well in heat is because you denature that, you destroy them in heat. They don't like it. Right? So if your body has been made a certain way that it makes it difficult for some of these things to survive, and you decide to reduce it to a certain temperature.
Doc, then what about those living in Finland and all those people?
Yes, because theirs is an adaptation.
Okay.
To where they are.
That's why some of us are not meant to live there.
Yes.
Yeah.
That's why even in this part of the world, some people don't like cold. And we keep laughing at that. They don't even too kind. Because if you travel before, you know that even in flight, when the plane goes a certain height, it's really, really cold.
It gets cold.
Yeah, it gets really cold. So those people, I've seen them in flights, when they are going, they have like kuntum. And you wonder, like, I'm like, it's summer and we are going to, like, when we land, it's probably warm over there. So what's with it? But in the flight, I realized that the first time I traveled, I didn't know. I wore a suit.
Okay.
So I had like a long sleeve shirt and a suit, I'm going to medical school, so I'm in black shoes.
Yeah.
But I left in September. I didn't know China was cold. Cold, I know it was cold, but not what
cold.
So in the flight, my feet started getting cold. In the flight, because the AC, everything is getting cold. Then I got my clothes are not enough. So I have to ask for a blanket. And then another blanket.
What about nose bleeding and ear bleeding from cold? I don't know if that...
No, that's because when it gets so cold for some of these people, the blood vessels that are there in your nose, they start to rupture. That's what causes the bleeding. That's why the bleeding is not prolonged. It's not so prolonged that they don't bleed like somebody who has been punched in the nose. So it comes like when they sneeze or they sneeze into a tissue or blow their nose, you see blood in there. Because it gets so dry. And it happens to people in Harmattan too, because it gets so dry in their nose that when they blow their nose, they start to do that. That's why in Harmattan, a lot of people doing the aerolizing, like steaming, to just try and get
or just moisture with the
balm,
balms and stuff.
What's that thing called?
Not mentioning any brands, but
but what's that? Okay. I wanted the menthol. I want to talk about what's inside.
Yes,
the menthol inside helps to ease it.
But Grace, in public health advocacy, what would you advise? Because also Chris said that poverty is a reason these things happen, right? But for the people who find themselves in these situations as poor people through no fault of theirs or whatever it is that the case is, what would be that advice you give to them so that they don't find themselves in these health situations?
Okay.
She has readjusted.
Take us in.
I know.
Take us there.
Okay. Health is wealth, and then I expect that whether rich or poor, we are all supposed to take our health seriously.
Yeah.
So regardless of whether you have substantial amount of money to take care of yourself or not, there are certain ways there are certain approach you can take as a person to make sure that you're in good health. So like Dr. earlier mentioned, staying in a well-ventilated place. You don't have to have all the money before you rent a space that is well ventilated, or probably even step out when you feel like there's a congestion in the room. And then you also don't have to have all the money for you to be able to do some home remedies when you see that you have cold, like using the gingers, the garlic, the honey, and the likes. So we need to take our health seriously. Whether you're rich, whether you're poor, make sure your health is priority to you. So do things that would help you, manage your health better, basically.
I think sometimes we take for granted when we have little body responses on things. Like you mentioned, we're in a congested space. It's congested, but you just want to, I can manage. But sometimes your body is reacting to certain thing. Your mind is telling you that you need to exit the space you are in, but we just take it for granted. Let me ask this question about breathing. So I'm smelling something foul, and I switch from my nose to my mouth. Of course, you can't hold your breath all through. I can give you an area, like you're passing around Lavender Hill, and there's traffic. I don't know if you know Lavender Hill. Do you know Lavender Hill? Lavender Hill is around Lavender Hill. Let me see Lavender Hill. Yes, that Kolegono area. Yes, because of the constant the feces they had been earlier. I don't know if it's still happening, but they had been what's the word?
Pumping into the water.
Pumping into the water. Yeah, so that area was suffered a lot of foul smell. And when it rains, it really got worse. At the point in time, I lived around Kolibus, where it was terrible.
Really?
Yeah,
Which
it was.
Manprovi.
Yeah. Oh, I don't want to go deep down. So I swear that. I swear that. Oh, I swear that.
You were there some.
Oh, I was there some. So it got foul. It got so foul that, like I said, when it rains, because we schooled in those areas. So when the wind blows, Charlie, you don't want to experience it. Or when you go very close to the sea, it's even worse because you see people defecating and all over the place and stuff like that. I can't tell about now, but I even see the slums have extended. At first, it was really beach, but now I see the slums have extended all through that area where they slaughter goats, fowl, and sheep, and all of that places. So sometimes we used to when you're driving past those areas and you can't breathe because it's that bad. You're not in an air-conditioned vehicle.
Even with that.
Yes, even that's another problem, eh? So you just want to inhale temporarily with your.
There's something wrong with being an air-conditioned vehicle.
No, I mean even with that, sometimes
You
it's
still
so
can
bad that
smell
you
it.
can still
He's
perceive
just
it.
Oh, like
Yeah.
when the
Yeah.
scent enters the
Yeah.
car. Oh yes.
Where am I wrong?
Yeah, Charlie.
Yeah, just a quick one.
Hey, I wonder if it's better to roll down the glass.
Because you'll be driving around these areas,
Yeah.
and you have the stench enter the car. It's not your fault. And you're like, okay, I mean, I just wanted some real fresh air. I'm too much into the AC, so I want to have some fresh air. And you go past a neighborhood or area, and there's this bad stench that captures the vehicle, right? And I'm like, okay, then my really glass on that.
But
AC.
you're retaining the smell in the car too.
That's why I'm asking you.
Yeah,
Shut up.
telling him more.
Shut up.
It's all yours. This one is all yours.
I don't- I don't
Off
know
the
what you
back
do.
of that question,
That's all
please,
yours.
so I'm just asking. I beg you, people. I beg you. Is inhaling when somebody farts and you smell it? No. I'm just asking.
There's
Because
chance that
It's
there's
a very,
chance that
it's a very important question.
Yeah.
there's,
Yeah,
yeah,
that-
go ahead.
So I know that you know the question now.
No, if somebody
When
farts
somebody
and you
farts
smell,
and
In
you
the
smell,
elevator.
are you at risk?
yeah, you are at risk. But the only good thing is that if the person is in the clothes, then it's filtered a bit.
No, but you're still at risk.
Hey,
Yes,
then people
because-
didn't do that for the elevators. They didn't try.
Because somebody left it there for me, you know.
Oh,
Somebody left it in
try.
there.
Like-
and then now
And it
people,
was still there.
And-
How the elevator doesn't have any form of ventilation.
Wait, they open and then left still there inside.
No, so
you know that thing when the person walks out, you know, I think he did it before he walked out. So sort of you get in and people get on with you. Then now you're wondering, is it you?
but I'm sorry, and I know we're not discussing fat necessarily, but it's fecal matter. I'm not saying you're going to ingest it again, but it's fecal matter in itself hazardous to the human body, because when somebody farts per se, does it mean that when I because I'm in the same space I inhale it, am I inhaling any bacteria or anything that can harm me in any
So
way?
number one, fecal matter. Nobody should. That's why when you ingest fecal matter, you get introduced to a lot of bacteria. Like you get cholera from it.
Okay, so
Right.
I know we're not discussing
Yeah,
fecal matter.
matter. So let me go. With
It is what the body
respiratory
is not using any
Yes.
longer.
So what happens
A
is
mixture of
solid liquid. And,
yes, yes.
gas.
Is it bacteria infected solid liquid
No,
gas?
no,
It's not.
It's just biogas.
Okay.
So the stench is from the decomposing fecal matter and the fluid that is there in that space because it stays so long in our cavity.
Okay.
So it's basically there. And it means it's a sign for you to just use the washroom, but people just take it for granted. That's why if you make a mistake and you think, oh, let me just lift my butt cheek and then give a bit, and then you realize that every time you sold yourself. You have to. Some people have been playing that game, that chess game with it. No, just use the washroom. Now, the worst part about it is that if you keep inhaling people farting like you inhale, there's chance that you might fart the same smell.
That's true.
And airdrop.
Wait.
True.
Wait,
Airdrop.
Yeah, Bluetooth.
True.
wait. How does that work?
Yeah, Bluetooth has third. It has third.
How does that work?
Airdrop.
Did you all just hear that?
A thermal airdrop.
Unprovoked.
You know, as well.
Wait, Doc, please. Grace, how
I
does that
actually
happen?
agree. Yeah.
How does that happen?
I am a mom, like I said, and I mean, when your baby farts, you can't run from the farts.
Yeah.
So I smell my baby's fart, and the next minute I can't. Yeah, the same thing. I'm like, wow. I did.
Dangerous.
Does it mean is it because I eat what is feeding from my breast? Does it mean that we have to fight this. I don't know if you get it.
Yeah.
If somebody is being
Is this biology or scientific?
I'll have
What
to
is
research on this. It's there. It happens, but the biology of it or the pathophysiology of it.
news to me.
I'll get you the information on it because it's so weird. Because you inhale it, and the next thing you actually doing it's like yawning. Somebody yawns, somebody starts yawning.
That's understandable.
That one will come to it.
So, Doc, essentially, I'm saying the farting is contagious.
It's yes.
You know, it's just like when you see a brother pee.
It's not
and
just
And then you feel like peeing.
You feel like
Yeah,
peeing.
you
It's
feel like
not
peeing. Yeah,
just
there's that.
farting,
I think
there's
it's
none of the
psychological.
fat.
Yeah, that's what I'm
It's
saying.
psychological.
It's
Yeah, it has to
psychological.
be because this one there.
Or Doc, it's your mind that is telling you that.
No. So like because we are in flu season right now, my advocate is that people like your water, please boil
Yeah,
it.
drink
Get your flask, get those you have ulcers, please avoid the citrus fruits for now. You can take the the artificial vitamin C's now off the counter. But the hydration is very important. Hydrate. Common cold, the airborne, they don't like hydration. That's why they make you thirsty. When you have a common cold, you have a flu, you get really, really thirsty. Like your mouth gets dry and everything. Yeah, because it's dehydrating you. So you need to push back by hydrating yourself. I know it's difficult. The soups are important. I have an aunt who used to make soups. We call it the Healing Jesus soup. Shout out to Ma Mercy. When you have a flu, Charlie, that soup, you take it, you sweat, you shake a bit, then
It's
within
gone.
2 hours,
The one with the ginger and the pepper and that.
that combination, the
Lice-
dry fish.
Yeah.
Yeah, it's not nice.
Okay, so I wanted to ask, it's great you mentioned this because I noticed that that's like the go-to meal
Remedy.
for or remedy.
Yeah, for
or maybe
soups.
meal
Yeah.
for people who have cold. Like as soon as you get cold, do light soup for him, do light soup for her. Like why?
Pepper
Why
soup.
is that?
Is it because of the pepper
soup,
in it?
The
What's
part of
what's the
it,
ingredients?
the fluid part of it, and the part that contains the nutrients in the natural state.
Okay.
You don't done anything to it. You don't put Maggi or anything inside. This is soup at its basics. So you're hydrating the body. You're helping your body get nutrients, absorb them faster in fluid form. You're also putting your body the heat that
The
it produces.
heat,
The heat is really, really important
Right.
because the whole pathway, the whole respiratory system is on fire. So you are sort of washing down everything back to your stomach where there's acids that will kill the virus. So you're basically, that's why it comes with it's difficult to drink at first. That's why your nasal passage starts opening up.
Yeah.
Then all of a sudden, it's going down further. Then all of a sudden you feel like, I'm sweating, like I'm sweating. Yeah.
Okay.
So,
Okay.
Our
Just
time is
60
up, but ask,
please.
Yeah.
so my last thing I want to say
Okay,
before you
you
have your
should-
question is
yeah.
simple. If you're having a cold or coughing, please use a nose mask. COVID is not gone.
Thank you.
Get a nose mask. It's not gone. The nose masks are cheaper now even than before. Get them into your bag. You feel like you have a cold or cough, protect those around you. Right? If you're going to a place that is crowded and you feel that you are somebody who is susceptible to allergies and cough and sneezing and all that, you know what to do. Get a nose mask. Don't let people look at you weirdly and think that no. It's for your own health. Because when you are sick in your house, I'm not there. They are not there. They won't visit you even. So do what is best for you and then deal with it. And those who live a family with people who are susceptible to some of these things, you should advise them. If they know the period is coming where they are getting these things, you should start taking measures. And if it's severe, see a doctor.
Doc, there's a question on Facebook real quickly, then we can wrap, Oily can ask
Okay.
this and wrap up. I attend a lecture on natural meditation practicing and was told cold and mucus can be removed from the system by consuming products dominant in copper and carbon. Moringa have enough of these compounds? He's asking. It's from Emmanuel Aintree or say.
Yeah, so Emmanuel, with that, you don't want to increase that dosage in your body because then it's going to cause other systemic issues. So it's moderation. Though we talk about all these things, the ginger, they're all in moderation. We all advocate, but it's in moderation. Some take it too far because you take it too far, those things will leave behind. Right? Because it's a detox, it's going to clear everything else. When you want it to do one particular job. But with the mucus thing, if it's in your throat and you need to move aside and spit, please do that. I've seen people swallow it. I've seen people I can see them doing that. Like you can see it's coming into their mouth and then there's cheeks puff up and I'm thinking, okay, he's going to go to the washroom. And then like, you see that?
It's gone.
Then it's gone like, whoa, he just did that.
Okay, Oily, you're going to ask and then we wrap
No, I
up
was
with
just
that.
wondering why sometimes you think it's a regular cold and then it brings out a whole different sickness. It could be like
Malaria, it could lead to
malaria. I was just wanting to find out at what point does that transition happen?
how-
Because
yeah.
I want to believe that my mom would say things like, "Oh, there is a sickness lying in wait, and then when you got the cold, They just
Yippee.
brought it out,
Triggered it.
right? But you go to the hospital to treat cold and flu. So how does that transition and that teamwork?
All right, so as long as you're exposed to any of us who has cold here, there's chance that you have cold.
Okay.
Right, you have cold, but you're asymptomatic.
Okay.
Right, there's chance that even right now you're sitting, you have TB, but asymptomatic.
Okay.
It's latent in the sense that it's not enough for even if I do certain tests, I won't find it.
Okay.
Because your body's immune system is so strong, it has suppressed it.
Like a certain womb.
Yes, it has suppressed the system. Now, what happens to that is that if your immune system is like a bodyguard you're given to guard this door, and there's nobody else to guard the other door, and there's a problem somewhere else, he might want to be distracted and want to like go there and do
check
that.
out, see what's
right, check
happening.
it out, and then leave this ajar, which means that those there will come in. So what happens is that your immune system, you need to constantly helping it out by exercising right, eating right, doing the right things, because you help your immune system out. If you start doing something like you lack of sleep, you don't rest well, you're not eating well, your hydration is low, you actually, the things that give your immune system armor to fight the infection is gone down, means that anybody else who's stronger than your immune system will come after you. So the common cold starts by opening the door for another one to be like, oh, he's gone. Let's play.
So we might all be sitting here with malaria.
Or infection, but maybe if I do a test, I won't see anything.
Away from opening that door.
Yeah.
Yes.
Yeah.
Jay, last one.
Okay,
for the
please.
boys.
Our time
For
is
the
really
boys.
up. Okay.
I noticed that some alcoholic consumers, right, because you talked about cold stuff, right, when they get like cold and stuff, or maybe they are sick, they drink hot
Gin.
gin.
They're using what we call it's systemic. It's a heat. They're just trying to produce natural heat.
Is that more like a placebo?
It's like you know that thing where it makes you feel hot. I feel hot. It's high. It did not do anything. It just get you drunk. And if you're a woman who's doing that, it's going to get you drunk and more honey. So don't do that.
My takeaway this morning,
Hey, Chris.
Grace, and Grace, thank you so much. My takeaway this morning is that if you stay in a place or with friends who fart a lot, it's likely your fart will smell
alike.
same.
Your fat will
And on that-
become twins.
And on that note, stay away from friends who fart a lot.
Airdrop
Peace.
too.
Culture Daily was brought to you by Telecel.